Good evening. My name is Tenny John-Idiagbonya, and I'm presenting my Sleuthing journal on community health promotion. The city I picked is Baltimore. This is the area where I work, and the population is over 600,000 with more females in that area, and less than just barely one third of the population is over 47 years old. And and above, and the it consists mostly of African American, includes insured and uninsured residents, and the average life expectancy is about 70 years old. And that's the landscape of Baltimore, surrounded by water. For healthcare access, there are clinics identified around. We have the Maryland Department of Health is the state's health department. We have University of Maryland Medical Center in Baltimore. We have Johns Hopkins Hospital in Baltimore with the different arms. We have a lot of private practices also in Baltimore and a lot of community health centers. And I focus on Baltimore City Health Department, which offers free. They offer free and affordable clinics for medical, dental, and behavioral services for the uninsured, about 11.7% of the population, and that's Baltimore City there. For the public health service, it runs from the city through the county and the states. City collaborates with the states and federal stakeholders to ensure that resources is provided to the residents, and they provide services from general health services through children's services, women's services, and senior health services for insured and especially the uninsured. But more can be done in this area because there is an issue of health disparity. So that can be improved upon by ensuring that the quality there is access to care, and also is the care that is the right quality. And I picked the local Baltimore City Health Department, visited and had received some brochures of their program for the elderly population. This the aging services, as it is called, and they provide an array of care support, in-home care, safety and protection for the seniors, and also even encourage volunteer services. They collaborate with the state Maryland Access Point to provide information and assistance to resources, and this can include them receiving home meals and other assistance while in the community. For vaccination, the vaccination rate when compared to the national is about the same because it stands at about 77.8%. Families that are not insured, they receive their they can receive their vaccination for their children at community health clinics and at the schools. Flu shot is also given at the local health clinics, community centers, and the schools. And there are mobile vaccination clinics that help to take the vaccination and also the information awareness, great awareness for the the residents that are in the city. We have pharmacies also and minute clinics that provide this vaccination service, which is where I can get my flu shots, where they can easily get flu shots. And the cost is about 39.99 cents, and this for them to receive this. For disaster planning, they continue to provide disaster planning for extreme cold and hot emergencies, and the information is received. They receive the information through listening to weather updates, working with the city and from the hospital emergency department for any target any issues, any crisis, so that intervention is immediately provided. And also they provide awareness through seminars, through fairs and conferences. This, you have the steps of to disaster preparedness, where they identify the risk, develop a plan, implement and train, and then encourage the community to lead. You be leaders, the residents to be leaders in the community, in their different little community. I believe this form of outreach is effective, because they take the message to their community, and they are the ones delivering it to the community themselves, and it's more receptive that way. Healthcare promotion is delivered in different ways also. We have an example is the dental work. Healthcare education is provided through fairs. We have the goal of Healthy Baltimore 2020, which aligns with Healthy People 2020. So it's like Healthy People is the global vision. And now we're taking these are like mini visions within the main one. And when this is accomplished at this level, it is good for the global vision. And nurses also are playing a very significant role in this in Baltimore, taking the lead. The community is engaged in different ways: clinical care delivery, employees and business, media, educational sectors are doing their piece, and also government agencies are involved in this. They use flyers. You can see an example of a health community and resource fair that was held. They provide flyers, and they use media also. Call to action, as we saw in the emergency preparedness. I believe that it's effective. Um, media form can be effective in carrying this out. That's another community engagement forum. For reflection, the level of service is good, but of course, there is always a need to improve upon what is being done to ensure that the right population is receiving the information that is being disseminated, and also that the access to care is not just access to any care, but access to affordable care that is of good quality for the community. Thank you.